Okay, so for NG, tube insertion, I will check the patient's medical records and gather all my supplies. I will perform hand hygiene and put on any PPE that's indicated, and then I will go into the patient's room, identify the patient, make sure I have the right one, and then I will assemble all my equipment, which I have done here already. I will make sure that the patient is in a comfortable position, upright, for the insertion, and that they are comfortable. Inform them that this procedure might be a little uncomfortable. I will make sure that I close all the curtains, shut the door, so there's privacy. And then I would begin by placing this over the patient. As I place it over the patient, I'll also give them a basin and some water with a straw so it's accessible to them. Then I would measure. I'll also give them some tissues in case there's some teary eyes or whatever while this procedure is going on. Then I would measure the tube from the nostril to the ear, and then down to the xiphoid process, which is already marked, so I'm not going to mark it again, but there's a piece of tape on it to mark it. And then, once I'm done with that, I will go ahead and put on my gloves. Pardon? I already have a piece of tape ripped and ready for after the insertion. I would ask the patient to occlude a nostril, and whichever one they can breathe better out of is the one that I would insert the tube into. So for our case, it's going to be this side. I would explain to the patient that if there's some gagging or anything, we have water here for them, and so I'll begin by inserting the tube slowly, and if they begin to gag, I'll encourage them to sip some water. If they were to continue to gag, I will stop the insertion, and then have them continuously sip water until it gets the bearing, so that every time they swallow, I'm continuing to push the tube down. So once you have it in the appropriate spot, all the way to your measurement, you'll stop. And then you will grab your syringe. You can check the pH to see if the stomach contents seem normal. Take those out. You would clamp it to take the syringe off. Use a pH strip to test, or you could have an x-ray to have it tested. And then once you're sure that you have it in the proper location, you will go ahead and secure it by taking a piece. Well, first I would actually, I think I missed a part. I would have already looped this up to at least 2 inches of the tube before inserting, and then any topical anesthetic put on the inside of the nostril. Then before you begin to secure it, you would wipe off the nose, make sure it's clean, let it dry, and then you would go ahead and make sure you're not covering the other nostril. Wrap this around and make sure that it is secure there above the nose. It wouldn't normally be as big as that. Then you would secure on, then you would want to measure the length. You'd measure the length of the tube from the nostril all the way to the end. So document your measurement. Once you have that done, you'd want the patient to face towards the opposite side, so you give them a little room. You would secure it onto their gown with a pin, or maybe here with a button or something. Secure that down. If you have a double lumen, you want to make sure that it is above the patient's stomach. And then yeah, so then if they needed anything after this, you would remove all your supplies, see if they needed any oral hygiene, some sort of like lip moisturizer or something, and then you would remove your PPE, make sure the patient's back in a comfortable position, move the bed down, remove all your stuff, and then remove your PPE and perform hand hygiene.